Alrighty, it is time to wrap the wrist. So to wrap the wrist, you are protecting the thumb joint, which is the MCP right here, and it also supports it as well. It prevents hyperextension and excessive thumb abduction. So as you can see, abduction is going away, so going backwards. And then, so to start off, we are going to make sure that the wrist is dry and clean. We are also going to make sure there's no jewelries and no wounds, and then that the hand is in a neutral position. So you don't want it like up or like down or together or floppy or anything like that. You want them to make a big hand. So as my athlete is doing right here. For this wrap, we are going to be using pre-wrap, which is just a barrier between the skin and the tape. 1 inch tape or 1.5 inch tape. And then just for this demonstration, I'm going to use green to show you what a spica is. So first we are going to start off with pre-wrap. For pre-wrap, you want to make sure you do a dog ear, which is just bringing this down to keep it from undoing, to keep like the pre-wrap from falling down. And then you're going to do 2 anchors. So the anchors, you're just going to make a little peak. All right, and then you want to overlap just slightly, just like that. Okay guys, so we are going to be doing a spica. So a spica is simply just a figure 8. So you are just going to go right in this little section of the thumb, crossing over the MCP joint. So you are going to go towards the wrist first, and then towards the palm of your hand. So just making that pretty X. And then for this, you are going to use just a half strip of tape, so just 1 inch. So you can just split it in half, and we're going to do a total of 3. And you want to slightly overlap them every time. And then our last one. And then for these spicas, it's important not to like excessively pull. You still want to give the thumb support, but not like pull it forward or backwards. Next, we are going to just do a final little anchor and just to secure it. So this will be 3 just strips of tape, and with these you want to do distal to proximal. And then depending on the size of your tape, you could only need 2 or just 1. Well, 2 probably at the least. And then you're going to check for windows. So I have a little window right here. So I'm just going to cover that up with a piece of tape. Windows for wrists aren't super serious because they're going to be wearing a glove, so it'll prevent friction. So that's why we want to either cover up those windows, but again, they're going to be wearing a glove, so you want it to be least bulky as possible. And then finally, you want to make sure that it is the appropriate tightness. So you are going to check capillary bed refills, pinken up just perfect. And then to take it off, you are going to use the blunt-ended scissors, cutting away from the patient, not towards, away, or you can also use a shark.